Hi, I'm Mr. I, Consultant Urologist. So let's talk about urology, because a lot of people don't really know what a urologist does until they actually need one. Urology is the area of medicine that deals with the urinary system and the male reproductive system. This includes your kidneys, your bladder, your prostate, and your ability to urinate properly. So what kinds of problems do we actually treat? It's quite a few actually. Things like difficulty urinating or needing to go too often to pee, bladder leakage, urine leakage, or we call that incontinence, kidney stones, bladder stones, urinary tract infections, prostate issues, erectile dysfunction, and fertility problems in men. And a lot of our work is with urological cancers of the kidneys, bladder, prostate, testicles, and penis. They are real health concerns that affect your quality of life, but the good news is they're treatable. You don't have to just live with it. So what happens during a urology appointment? Your first visit is often just a conversation. We'll talk through your experiences, your medical history, and if needed, we might do a physical examination. In some cases, we might request tests like urine samples, blood work, or an ultrasound scan, depending on what we're looking into. We completely understand that you may feel awkward for some, but don't worry. These are very common health issues, and we talk about them with patients every day. Our team is professional, discreet, and focused on making you feel comfortable and respected at all times. So what kinds of treatments do we offer? Well, that really depends on the problem, of course. Treatments might involve medication, physical therapy, lifestyle advice, and sometimes a procedure. Whatever the issue, we will work with you to find the most appropriate and effective solution. So what if we're dealing with leakages or bladder issues? Well, that's very common, and a lot of people experience that of both sexes and often come to see us about this. Symptoms like urgency of urinary frequency or frequently going to the toilet or leaking before you get to the toilet are treatable. We might recommend bladder training, medication, or other targeted therapies to help. So if something's been bothering you, whether it's urinary symptoms, sexual health concerns, or anything else to do with the prostate or the reproductive system, don't suffer in silence. Reach out to us because we're here to help.